Hi everyone, Dr. Liz here. I want to show you what my eye looks like after a vitrectomy or a macular pucker surgery. Okay, it's not bleeding, it's just that the blood vessels are broken there. And nobody prepared me for this. It's going to be this way 2 to 3 weeks while it heals. I scrolled through pages of videos on YouTube trying to look like, can I see what this looks like? There's animations, there's doctors talking, but I didn't find one where someone's like, hey, you're going to look like this, you're going to look like a demon, okay, for 2 to 3 weeks while your eye heals. So here you go. I am not in pain. My eye does get more tired and more sore, I would say, since the surgery. So I had a surgery on Tuesday. This is a Friday. I am back at work on Friday because I don't do real heavy computer use. I'm a therapist, but which the doctor said would be okay, but I would tell you now, you probably need to take a week off of work if you can at all, just because it does take time for the eye to heal and your eye tires more quickly. That's it. Even if you're not on the computer or reading stuff, your eye's just going to tire more quickly. There's also a psychological component to it, I think, that just has you tire emotionally a little more quickly. So I do have an air bubble in there to help the wound heal, and so the lower half of my visual field is a little distorted and the air bubble moves around with it. It's strange. I also looked for a video of that, like, can I show somebody what it looks like from the inside of my eye? I can't find that one, so if someone has one and you could post it in the comments, I would love that. Okay, I do have to sleep with a shield for about a week. This is a shield, it's not an eye patch. See, it has a little cup to it, okay? And so I do that, and I just put the tape on, fresh tape every night, and I sleep like that. So if you have any problem sleeping, I'm a sleep specialist. I cannot help you with that. It's just going to be uncomfortable, like really. You're going to have some problem sleeping for at least the first week while the shield is on. That's it. I was up probably 3 or 4 times last night, watched some TV, had a good book to read, yay. Some of that was the dog who's not doing so great. Took care of her. She decided to like run around with the zoomies in the middle of the night. So even if she hadn't, I would have been up because of the shield. It's just, not great for someone who struggles with sleep. Okay, my alarm is going off to put my eye drops in. After my cataract surgeries, about 4 years ago, you have to put drops in multiple times a day. Same for this. And you shake your little drops right here and just put them in. I set alarms on my phone. That's the easiest way for me to remember. Your eye does not look like this after cataract surgery. So this is why I felt a little unprepared, like nobody told me this. My eyes looked perfectly normal after cataract surgery. I had light sensitivity. I had some pretty massive headaches because they did one eye and then 2 weeks later did the other eye. But this time I'm having some headaches maybe in the evening and some soreness in the evening. You obviously have to check with your doctor. This is not medical advice at all, but he said I could take some Advil or something like that if that happens. But it does get tired more easily, but again, this is what it looks like. Okay, I do wear my sunglasses, obviously, when I'm out and about. I can't do therapy that way with them. Let's see, anything else? I think that's it. If you have an upcoming surgery and you want a hypnosis for it, please let me know. I am a hypnotherapist, and I didn't prepare a special one for this surgery because when I went back and listened to the one I did for cataract surgery, it is fantastic. It has all kinds of good healing stuff. It has stuff about how to prepare yourself for the operating room. You are in sort of like this semi-aware state during the surgery, and it really helped me through that part to do just like positive healing affirmation kinds of stuff. So I was in surgery for about an hour, and I just kept, thinking about different things like I'm going to heal wonderfully, and the eye feels cool and comfortable, and just different positive phrases that would come to me. So If you want a custom hypnosis, let me know. You can visit my website, drlizhypnosis.com, but I also have that cataract one for sale, which I think is a great sub for any kind of eye surgery. So you could buy that one as well if you want to do that. And I have a version with music and without music, so either one. All right. I will talk to you soon, people, and hopefully the next video I make, I won't look like this, but who knows? I'm going to make it anyway if something occurs to me. Oh, final thing, you want to keep your stress level low. So my ex-husband, who's a total narcissist, just started on the warpath a day or two ago with me around texts and emails, and I realized that it was like raising my blood pressure a little bit. Not a great thing right after you've had eye surgery. Narcissists don't really care what surgery you've had, or sometimes they have like this fine tuning that it's like, oh, my ex-wife is under massive amounts of stress this week and trying to heal. Let me start some shit with her. Okay. Like that's what a narcissist does. They're just thinking about themselves. So I realized when that was happening, I was just like, I need to ignore everything right now. That's it. All of these emails can be answered next week, or not at all. Or these texts, I just said, hey, you got to email me. Don't have a whole lot of phone time this week because of the eye surgery. So put all that stuff up. So the more that you can reduce your stress that week, the better it's going to be for you. So that's something to just keep in mind. Sit around, watch TV, read some books. That's it. Just relax. All right. I'll talk to you soon. And if you want to subscribe to my channel, fantastic. Hit that little button, wherever it is. All right. Bye. Peace.